Good day everyone, my name is Robert James Torifiel, a student nurse of General Santos City Doctors Medical School Foundation Incorporated. And for today's video, I'm going to demonstrate administering intradermal injection. So, let's get started. So the first thing we must do is we are going to assess the appearance of the injection site. We are going to assess if there is a presence of lesion. So, good morning, sir. I am your nurse for today. I am Nurse Robert James Torifiel. Sir, mag-skin test ta, sir. Okay lang sa iyo, sir? So, okay lang bagunitan ako imong kamot, sir? So, again, we are going to assess the appearance of the area where we are going to do a skin test. We are going to examine if there's a presence of lesion, because if there's a presence of that, it can be a hindrance in absorption of our medication. Then after that is we are also going to assess the specific drug action and also the expected outcome or expected response, so that we can able to share it to the client the possible side effect of that drug. Then after that is we are going to assess also the client knowledge on drug action and response. And lastly, we are going to check the agency protocol on doing or conducting a skin test, because some agency or some healthcare facilities, they have a specific protocol that if you conduct a skin test, you are going to conduct on that specific area lamang. So, kunwari, sa may kamay lang or sa iba pa dyan. After that is we are now going to assemble all the equipment and materials that we need. So we have here a sterile syringe, or one of the examples is a tuberculin syringe, so 1 mm, 1 cc. We have also an alcohol for disinfection or for hand hygiene. We have the vial of medication, the gauze, Band-Aid, epinephrine. So we need to do this, we need to assemble so that we can less likely to waste time and for us to avoid committing error. Then we are going to check the medication administering record. We are going to check the label of the medication. We are going to follow the 3 check. We are going to check when it's taken from the medication cart, before withdrawing and also after withdrawing. So we need to do this so that we can make sure that our carrying out medication is for the correct patient. Then after that is we are now going to organize the equipment so that we can less likely to waste time. And also after that we are now going to perform hand hygiene so that we can less likely to harbor microorganisms and for the infection control. We are going to prepare the medication from the vial. Then after that is we are now going to prepare the client. Then we are going to explain to the client that the medication will produce a small wheal or bleb. So we need to do this so that we can facilitate compliance and acceptance of the therapy. So, sir, kanya itong buhaton nga skin tester, magkaroon na siya gamay nga burog sa mga kamot, sir. So, ayaw lang kagkakulbaan na, sir, kay it is a normal result, sir, during skin test, sir. Okay lang sa'yo, sir? Then, we are now going to provide privacy by draping the curtains. So, we need to do this so that we can gain trust and cooperation to the client.
To select and clean the site. Avoid using sites that are tender, inflamed, or swollen, and those that have lesion, because this condition will hinder the absorption of the medication. And then we are now going to put on our gloves as indicated by agency policy so that we can protect ourselves from getting contaminated. Then we are now going to cleanse the skin at the site using firm circular motion, starting at the center and widening the circle outward so that we can really get rid from the microorganism on that site. Then we are going to allow the area to dry to prepare the syringe for the injection. We need to remove needle cap while waiting for the antiseptic to dry. Then expel the air bubble to dry. Then expel any air bubble from the syringe. Then we are going to grasp the syringe in your dominant hand, holding it between the thumb and forefinger. Then hold the needle almost parallel to the skin surface with the bevel of the needle up. We need to do this so that we can prevent to inject the medication on the subcutaneous site or subcutaneous part of our body. Then we are now going to inject the fluid. With the non-dominant hand, pull the skin at the site until taut to allow the easy entry of the needle. Then we are going to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis. The outline of the bevel should be visible on the skin surface. Then we are now going to stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. Then we are now going to withdraw the needle quickly at the same angle at which it was inserted. Then take note, we should not massage the area. And also we are going to dispose the used materials properly. And we are going to remove our gloves. And also lastly, we need to circle the injection site.
So, after removing our gloves, we are now going to circle the injection site for observation for redness or induration using a black ball pen. Then, after that is we are now going to document data such as the time en route, the site, the dosage that we give, dosage of the medication, and also the nursing assessment. So we need to do this because if it doesn't document that, it means it didn't happen. So we're done. So thank you, sir, for your cooperation, and thank you for watching.